Morning, everybody, and welcome back to the 2022 Population Health Collaborative Conference. As a reminder, today's meeting is being recorded. Attendees' cameras and microphones have been activated. However, we do ask that the microphones remain muted. Following each of today's presentations, we will have time for question and answers. You can either ask your questions live on camera or post your questions in the chat window. You can also join our discussions online through our discussion forum at www.nmhealthequity.org/phc. Now we're excited to have Ms. Sheryl Wilkeson, our Community Impact Director for New Mexico and Southern Colorado with the American Heart Association. Sheryl has had the privilege of making a difference in the health and lives of people in her community. Through her work, she has had the amazing opportunity to improve and extend people's lives by building powerful partnerships, speaking with a trustworthy voice, bringing science to life, meeting people where they are at, and ensuring equitable health for all. Please help me welcome Sheryl Wilkeson.
Hello, thank you very much, Bianca. I am pleased to be here, and thank you for the extending the invite to present to you about some the resources that American Heart Association has and some of the work that we're doing as we're addressing public health here in New Mexico. Full disclosure, I have been awake for 30 hours. I've been by a loved one's bedside. So I am telling you that I am living what we are talking about. So it was very important for me to be here and share some of the stuff that I am going to share about heart health and reaching out to our community. So I'm looking forward to Sarah's presentation after me for some of the breathing, and I'm sure Bianca is too. I think I probably put her in a situation, but thank you for supporting me as I work really hard. This was meaningful for me to be able to present what I'm going to share with you today. So yes, let me go ahead and share my screen. I have a little PowerPoint to kind of go through. So if I just do that, and we'll do this and see, and boom, and do slideshow. Is it showing up? All right, but
it looks great.
Okay,
looks great.
Do you see the block?
It's perfect. Nope.
Okay, perfect. Very good. Oops, let me go back one. Let me go. There we go. All right. So yes, I have the wonderful privilege to be working for American Heart Association and all the great work that it is doing in the community. I am new to the Community Impact Director, but here in New Mexico, but have been with American Heart Association for 7 years. What I would like to talk about today is really share with you the resources that we have, share with you the work that we're doing, the resources that we have available, always looking for collaborations in the community, and then opportunities. I am Community Impact. My work is putting our work together in the mission to work in our local community, but we have a team of advocates. We have a team of fundraisers, so opportunities to collaborate and get some funding to do some meaningful work. Let's see. Some of you hopefully are familiar with some of our work in the community, but this is kind of a picture or a road model of what we're doing in our communities, where we are working. Like I said, we definitely do advocacy work. We are partnering with schools. The work that we're doing a lot right now in our schools is addressing the tobacco and vaping epidemic. That's work that's really important to us. For just a few years ago, we thought we were looking at raising the first generation not addicted to nicotine. Unfortunately, vaping has changed that. And so we're working to educate and support schools who are on the front row, on the front line of this with that, to provide good resources, tools, and support for students who are in that situation. We also work with the schools who do CPR training. So it is a high school requirement for graduation that that students learn hands-only CPR, and so that equips our students to be lifesavers in our community. Also, we are working with them about their cardiac emergency response. AEDs, well placed in the in schools and out in the where the athletes are playing. So those are really important things that we're doing in our schools. I'll kind of come to addressing determinants of health in a little bit, but we definitely do work with the community and the clinics. So that's important to know that we try to be everywhere where people are working, playing, praying. So we really want people to know that we're there to support them. A lot of the work that we do in the community is education, raising awareness, and providing resources and tools for healthy lifestyles and prevention, raising awareness, and then providing tools and resources for people who are, looking for prevention, but also looking for better health. We're working with building healthy families. We work with a lot of the complete streets. We want communities to have safe environments to go out and be in the out of doors and exercise. We working in workplaces. We know that the majority of people, of adults, spend most of their waking hours in the workplace, and it's a great opportunity to make good choices, to help employers create healthy workplaces and a culture of health. Absolutely working in our hospitals. We are very proud to be providing research dollars to really move heart health and stroke care along, as well as creating best practices and support and resources to hospitals and the care and after quality of life afterwards. So those are some of the things that we're doing, advocacy and public policy. And as always, research is the cornerstone of the work that we do. We did do a shift about 2 years ago. I think the world did a shift 2 years ago. So American Heart Association has always been interested in social determinants of health and looking at all the factors that add to a healthy lifestyle. We did see, being a research evidence-based, data-driven organization, we started to see some huge disparities really come to light during the COVID. And so that really made our organization take a hard look at what was going on, and what they found, or it really came to an aha moment, is that if we are going to be a healthy organization, we really need, or a healthy world, we need to really address health inequities, that there's huge disparities. We really saw the impact of COVID-19 really fall along social economic status, communities of color. So really during this time of learning this, American Heart Association really did double down on how they're going to address health in our communities and really focus on health equity moving forward. Some things that are very scary to us coming out of COVID is that coming out of COVID, we are a less healthy population. Heart disease is up, stroke is up, diabetes is up. So we really want to make sure, I want to go back one more, sorry, that we do that. Life expectancy has dropped. So we really want to double down on the work that we're doing. And this is only through collaboration and working with our partners and amplifying each other's work. So out of the COVID-19 and then looking at the work that we do, we usually do impact goals every 10 years. But really what we saw is that there was such an urgency to address health inequities and disparities that we made a shorter goal. So this is our 2024 impact goal. And so really what it is that it's that we are want to go after and really be champions of health equity. And what that means is really looking at and covering and addressing the barriers to health equities and address the things that are leading to the health disparities, which are social determinants of health, structural racism. We believe structural racism is a health crisis in our country. And then here in New Mexico, we live it every day. You know, people talk about rural, you know, we definitely know we're rural and even frontier communities here in New Mexico that, that really hit hard in our communities, because beyond how the rest of the world was addressing with COVID, they used, you know, it went to telecommunications, it went to really online. And then we find communities all across our state that don't have access to be able to do telehealth through the lack of technology. So we saw a lot of disparities that really kind of widened the gap that was supposed to really be a Band-Aid or a help through the COVID-19. We talked a little bit about the barriers to health, so social determinants of health. Those are things that we've always worked on, but those are things that we're really concentrating on. Again, what I said, we talked about structural racism and rural health. So what does that look like for American Heart Association? What does that look like for me doing community impact in our work? So what we saw is we saw 5 areas, and it was really addressing health in women, which includes maternal and health, addressing community needs. At the time when the COVID-19 first hit, it was really addressing COVID-19 and how to create, work with first responders, how to do CPR in a safe environment. But it also includes, now it includes a broader band of what that looks like, as really emergency or crisis, addressing the community needs based on the crisis situation. As I talked about, ending cigarette or commercial cigarettes, and tobacco is very important, controlling blood pressure. So, and nutrition security. And I'll kind of dive into a little bit deeper at this, but did want to just kind of, as we look at this, see that equity is at the center. So equity is at the center of what we need to do. Every time we look at this, we really need to look at equity and addressing those barriers is important. So that's kind of at the center of the work that we're doing. One thing that is also important is mental health and mental well-being. We are the American Heart Association. We are Heart and Stroke. We are not mental health care, but what we do is talk about the science, and that we do and acknowledge the link between the brain and the heart, and that when a person has a sense of well-being emotionally, they are more healthy and more likely to be heart healthy and lifestyle healthy. So that's where we kind of fit into the well-being of it all. When we looked at this, this is our national kind of priorities. And then what we do is for each community here in New Mexico, we look at, then we take into consideration community health needs assessments that have been done by community organizations, by our health systems, and then we prioritize looking at that. Where's the gaps? Where can we move the needle the most? And that we bring expertise to the table and able to collaborate and amplify others' work. And then for let me go back. And let me talk a little bit. So I'll go into detail a little bit about it. But for New Mexico, those three things are tobacco and vaping, chronic disease management, which is we really focus on high blood pressure, managing blood pressure, but included in there is obesity, cholesterol, and diabetes. And then improving nutrition security. And so that is the work that I'm focused on. Doesn't mean that I don't work and do the others as well, but those are the ones that we really want to pound hard on here in New Mexico to see what we can do to improve the outcomes for people who are impacted by those. So what we work on, and like I said, we take those three things and we look for community transformation. And like I said, it's something that American Heart Association cannot do on its own. There's a lot of wonderful groups and organizations out there doing the work already. And so what our goal is that we bring the science, we bring the research, we bring the data, we bring some volunteers and hopefully some funding, and we bring the name American Heart Association, and that we want to partner with groups and organizations really to help address and amplify everybody's work that they're doing in this area. Or find the gaps that's not being met and work together to convene a group that's going to meet those needs. So a lot of our work is done, like I said, in partnerships. We kind of have two areas. We work with clinics in the health systems, very science-based. So we do a lot with clinicians, clinical organizations as a whole, again, bringing the science, doing best practices, quality improvement opportunities, really those kind of works with clinics as far as toolkits, staff training, resources for patient training. Those are some of the things that we do in the clinics. Out in the community, we do similar, but really lay persons focus on going, meeting people where they're at. We understand good healthcare and health is a journey. And so we try to meet people where they're at and provide them the tools and resources to create a greater sense of health and wellness. And so that a lot of that is going to where people are at, out in the communities, working with organizations that are looking to find ways to help support their own community. So those are a lot of the work that we're doing, both clinics and in community. Again, as I said, the three areas that New Mexico, that we're focused here in New Mexico, is nutrition security, blood pressure management, and tobacco and vaping. So, and we do adults, we look at adults and youth as well, but we really want to focus on our youth with the vaping situation. A lot of the work that we do in this area is about awareness, raising awareness, engaging, whether it's engaging partners, engaging the community, engaging individuals, and engaging clinics. So that's a lot that we do, improving. So it's whether it's improving systems of care, or whether it is improving health of an individual, health of the community, health of a group, and then achieve. So it is really, when we say achieve, we want whatever we want, we go in and we do. We are looking for ways for the change to be sustained. So we don't go in and just do a little program and hope that, oh, that went well. We look at ways that we can really sustain a change for improvement. So everything that we do is kind of intervention, where we want to change the trajectory of a person's health or a community's health. So that's some of the work that we do in that area. So I wanted to do a little bit deeper dive into it. So the work that we're doing in nutrition security is increasing nutrition security. A lot of that is working. That work is very broad. A lot of that is around, first of all, looking at that we're just not looking at food security. So nutrition security is a broader vision of that, is that it's not just about the calories, but it's about that we make accessible, good, nutritious food, whether or not it is with working with food banks to see, what they can do to make sure that they have higher standards of produce and vegetables, that we look at our food deserts that we have in our community, building capacity for food banks, because I know it's harder to store food that needs to stay fresh. It's also about education. Education is very important, educating the population about healthy foods and then also access. So it's access to sustained, not only access to food banks, but how do we get them set up on the resources that they need, that they could have sustained nutrition. So those are some of the things that we look at. We look at making sure that there's some important legislation coming up about meals in schools. So there's a lot of work out there that kind of runs the whole gamut of the work that we're doing in nutrition security. So we both work, like I said, at the organizational level all the way down to the person level. We have toolkits for organizations. We have resources and infographics for on our website, and I'm going to give you all those resources in a little bit, but healthy recipes. We always try to be culturally appropriate and acknowledge that and try to find healthy ways to be able to still honor those traditions and really do it in a way that is simple, easy to take in, that is helpful. So that's some of the work that we're doing in our nutrition security area. The work that we're doing in the ending tobacco use and vaping is, again, working with schools. So a lot of the work that we do is we look at school districts. We look at their tobacco and vaping policies. And first of all, a lot of schools are very aware of the tobacco and vaping issues that they have with their students. And we appreciate their eagerness to want to stop that for the health of their students. So sometimes they'll have like a zero tolerance policy. And we appreciate them wanting to have a real hard stance on that because they want their students to be safe. But sometimes a zero tolerance, which leads to maybe suspension or right away if they're caught, could compound the issue that maybe brought the student to be using tobacco or vaping. We believe that students need to be staying in school. They need access to support to find out if they want to quit. Tobacco vape education support. So what we do a lot is again, we have toolkits and information, but we really want to help the school districts set up policy systems of support versus punishment. And so that we can really work towards having tobacco-free schools, not because they're not allowed, but because they're getting their students to quit. So that's a lot of the work that we're doing. We go in, we assess, we make recommendations, we work with them with the school board or the shack, and things like that. We do a lot of advocacy work at, I have a colleague, Mahesh, he does lots of the advocacies at city councils, at school boards, and at the state level. So that's some of the work that we do on that. Reducing blood pressure. That is a huge top priority for us. So this is a multifaceted way of addressing, because there is, we do a lot of work with the clinics, providing them, again, clinics and community. So there's a lot of work that needs to be done here. So with our hypertension control initiative, we work with clinics to provide best practices. We have an online whole suite of tools and resources that's called Target BP, which is a collaboration between the American Heart Association and the American Medical Association. It is a robust program that really focuses on the clinics, providing them with the resources and the tools of everything that they need to implement and improve their control rates. A lot of that work is around, there's tools to assess them before they go in and start a program to see where they're at. Trainings, we have lots of online and on-demand trainings that are free. So we have some are free that are also continuing ed credits. So that's always good. Everybody's always looking for those resources and tools for them to provide to their patients, and that are really focused on them on how to do that. So a lot of the work that we do with that is, we are a big believer that cuffs, we advocate for self-monitoring blood pressure. That's the big thing that we're really working with. But we know cuffs don't control blood pressure. People do, partners do. So we have a program we call MAP, and that's what we do with our clinics. We train them on that, and MAP stands for Measure Accurately, Act Quickly, and Partner with Patients. And so through Target BP, it steps you through that whole process. We find that 90% of all blood pressure measurements are often incorrect. When they're taken in the doctor's office. A lot of it is, white coat syndrome, masked hypertension. It's a snapshot in time when they get that one time. We believe sustained long-term checking through self-monitor blood pressure is the best way to get a true picture of an individual's blood pressure, actual blood pressure. So we have all the resources and tools for that. We partner with a lot of clinics and provide work with our development department to get funding for cuffs to implement a self-monitoring blood pressure program for their patients. And that's really a lot of the work that we do with our clinics. We talked about Measure Accurately is really important. We have training on how to train and handouts for patients to have about how to measure, accurately at home. All the best practices on how to sit, what to eat or not to eat or drink before doing that, doing it regularly twice a day, in the morning, at the same time in the evening. And then how to, a calculator, an online calculator on how to average everything. So we really want to work closely with them. We truly believe that self-monitoring blood pressure is the best way to really get a clear view of it, because you can't control what you can't measure. So that's really important. Act quickly. A couple years ago, American Heart Association lowered the threshold for high blood pressure from 130 to 120. There's they call them different ways, but really what we want everybody to be below 120. And why that's important is that before they would say, oh, above 120, something will stop and watch. What we want is, if they're above 120, is for them to start thinking about and looking at lifestyle modifications before they need medication. So to start looking at their diets, start looking at their exercise levels and things like that, to see if we can address it and get our attention on things quicker and sooner before they do that. And that's act quickly and partner with patients. That's another thing why self-monitoring blood pressure is so great, because it really does engage the patient in their care and create them kind of a buy-in to it, and gives them some control over that, and through the measurement. And then we hope that will turn over to creating some lifestyles that are working on that. So that's some of the stuff that we do with the clinics. Like I said, through the Target BP, we support them through that entire process. Out in the community, we see a greater opportunity. I'm not going to share all the statistics, but I'm thinking that a lot of us know how prevalent hypertension is in our community, that it is the #1 modifiable thing that we can do for our heart and brain health. So, but we also know that it is the silent killer, that a lot of people with hypertension do not know that they have it, or because it doesn't have any side effects, or it doesn't really present itself that impacts their health visually or physically, that they don't really take it as seriously as they should. So we have lots of resources and tools that are directed towards the average person, towards a patient, towards that. But what we want to do is engage churches and organizations to really be partners with them. Some of the programs I've seen back home in California was with barbershops and places where people go and congregate and do that. So there's opportunities to do outreach, to educate and raise awareness about high blood pressure. And so that's one thing that we really want to get out there into the community and find ways that we can get out there and check high blood pressure and get the word out. Again, raising awareness, engaging, and improving is our goal. This is just an example of some of the work that we do, or the handouts that we have about blood pressure. Like I said, again, a lot of people don't think about, how they sit, impacts that the blood pressure, the taking of the blood pressure. So we really want to provide both for the staff that may be doing it in a clinic, because that's something that they learned way back in nursing school, and it's like driving a car. You just think you just kind of becomes automatic, so they really don't pay attention. So there's lots of training opportunities for that, and then also for the patients, that they can get the proper alignment and how to sit and how to get ready for taking the blood pressure. At this point, I want to have, I was going to ask questions, but we'll, I guess, yeah, let's go ahead. Hey, Bianca, sorry, I wasn't here earlier. So do we have time to do questions now? I'll do a wrap up with my resources, but wanted to see if, or do they come off mute to do them, or are they doing them in the chat?
So it's either way. So if
Okay.
participants feel comfortable unmuting, they can, or they could also put in the chat, and I'm manning the chat for you.
Okay,
So
very good, very good. All right. I just gave a whole lot of information, and just wanted to do a check-in to see if anybody has any questions on what I shared up to this point. All right. Well, I will take that as a no.
Sheryl, I do have a question. This is
Yes,
Bianca.
please.
So I'm assuming that most of these resources can be found on your website. And I believe there's another question also. Is the graphic that you shared on the last slide available anywhere? I believe it was the one, how to sit.
Yes, yes. And that is, I don't know what your plans are about sending stuff out, but I have a whole stack of resources. I'll edit, but I could definitely add the how to sit. That's a very important one. Absolutely. Yes, I could send that out to you, or they could reach out to me. But a lot of that is, and you could find it in Target BP. So anything with the, it's targetbp.org. And if you log on to that, and then under, I think it says tools and resources, it's a drop down. You will find a myriad of that, and that handout is in there. It might be under map, that's the measure accurately, but it's under tools, and I think it's tools and resources, or tools and documents, but it's tools and something, it's dropped down. And then there's videos, there's videos in there. We have lots of fun videos too. Like if you have if you were part of a clinic and you have the TV, that's always a good thing, or in a waiting room, or if you are part of an organization and you do stuff and you want to do PSAs and things like that, it's all there. Or please reach out to me. I had hoped to kind of add some links onto this, but I'm hoping I could send maybe a cheat sheet to you, Bianca, that you could send out with all the links, and I'd be happy to share that, where you can find some of the toolkits. And like I said, I am always here. There's so much information, so I can help navigate and direct to different things on our website. But absolutely, Target BP is a great resource for anybody who is interested in anything on managing, controlling target blood pressure. We also have something very similar for cholesterol, and something very similar to diabetes as well. So those are things. Blood pressure is our number one target, but we have those programs along the same lines for those two as well.
Perfect. Thank you, Sheryl. I really appreciate it. So we'll just give it a couple more seconds. Does anybody else have any questions, comments? Just a reminder, we will be posting these videos, slides, any resources that our speakers send us on our website, nmhealthequity.org/PHC. So we will be posting those.
And then I'm going to move real quick. I'm going to say, as I wrap up, then I just wanted to kind of circle back. Definitely that we are here to partner with you. We are here to be a resource to you, to the tools that we do have. We do a lot of fundraising. That's Sherry, and they do that so that these resources are available to our partners, to our community, to individuals, to clinics, to free and accessible to everybody, because we need to get the education out. And so please feel free to reach out to me. but then also if there's something that you are working in this area too, and that you want to partner with us, or want to know, what evidence, what research that we have on this, please feel free to reach out to me as well on that. So it's something we want to do as well. Kind of went off into where we went since post-COVID, but I want you to know that we are still American Heart Association and Stroke Association. So it's all about heart health and brain health. And so we still have all that information and resources about heart disease, prevention, and stroke and support groups and all of those information. So if that's something that you need as well, feel free to reach out. And then on the prevention side, we have a myriad of things. So I'm going to give you one more or two more email addresses. So American Heart Association has a website called Healthy for Good. So if you just go to heart.org and put in Healthy for Good, all of that is prevention. What they did is they broke down what prevention is into, I'll just say 3 pillars. It used to be 4, but they kind of combined one. So it's 3-pillar, and that is eat smart, and a part of that is add color. So the 3 things that American Heart Association says you need to be, healthy is to eat smart. So that's add color, eat as much fruits and vegetables as you like and you can. Watch your sugar, watch your salt. Those are some things. Move more. People often ask, what's the best exercise for heart health? And I always say the one that you like, because that's what you're going to do. So just get out there and move and do some enjoy and be well. I am talked a little bit about, I know what Sarah's going to present later. It is, again, that connection between the brain and the heart. About managing stress and really taking time to breathe. And we live hectic, crazy lives, and this pandemic did not help. And so we definitely want to make sure that we're taking care of our mental health, because that will impact our physical health as well. So that's an important part to do that. So those are 2 really strong resources. There's lots of infographics and really attractive, I'll say, kind of graphically easy, digestible information on prevention, anything if you're working in lifestyle modification in any of those areas. There are some great resources, infographics that you could just download right off the website and pass out to your members, your patients, all of that. So lots of resources that are there for you to use and distribute as we get the word out to the community.
Thank you so much, Sheryl. I appreciate everything and taking the time, given your circumstances. Really appreciate it.